It's probably one of the last things a parent wants their child to come home with, tuberculosis. But that's what happened recently with a student from John F. Kennedy High School. Coordinator of the TB control program at the Department of Public Health, Cecilia Arciaga.
The individual was referred to us by the private provider, and of course we did our initial workup, and it was diagnosed as a case of active tuberculosis. So as soon as the diagnosis has been made, I made contact with the school, informing them.
We had one of our employees.
JFK Assistant Principal Barbara Roberto says the school sprang into action, identifying those who may have come into contact with the individual.
Those would be the classmates of the particular student, the teachers, the student. If the student was involved in a particular club or organization or sporting event, then those the coaches and the students were also given the same letter.
A letter about 200 students and teachers received, informing them they must be tested for TB before May 23rd in order to continue attending classes. Free TB tests will be given on May 16th from 8 a.m. to 12 p.m. Roberto says the school's nurses do their best to make sure students' immunizations are up to date, but that's not always foolproof.
Maybe her records could have been up to date, and then she or he just came into contact with someone who was a carrier.
TB is an airborne disease caused by bacteria that can affect the lungs, brains, bones, and other organs of the body.
If you have the active disease and you're not treated, of course it can cause death. But at this age and time, there's no reason for a person to be dying of TB because, number one, it's a curable disease.
Early prevention is key, says Arciaga. She recommends anyone with a lingering cough or fever, common symptoms of the disease, be seen by their doctor. Reporting for Guam's News Network, I'm Lanny Walker.